Welcome to Practical Sleep Education. We have several modules which you are welcome to view and purchase if interested throughout our website. The modules work together so we are able to present dental sleep medicine to you and your team so that it's not difficult to understand or difficult to implement in your dental practice. I am Dr. Suzanne Miracle, a general dentist, and I practice in Georgia on St. Simon's Island. Together with Jeff Wisecarver, our RPSGT, we have started the sleep company, and we are going to present several modules and courses for you and your team. If you have any questions, please contact us by phone or email. Our contact information will be on our website and, of course, at the end of the module. We are excited to be here today and to present the module, What is Sleep? What we will be covering today are the sleep stages and their purpose, sleep cycles and architecture, most common sleep disorders, and health consequences of poor sleep. Sleep. What is sleep? Sleep is survival. Just like eating, sleep is necessary. Good sleep is a staple of ultimate health. While we may not think about why we sleep, most of us acknowledge at some level that sleep makes us feel better. We feel more alert, more energetic, happier, and better able to function following a good night of sleep. It provides rest for your body. It provides rest for our brain. It provides hormones for functions. However, the fact that sleep makes us feel better and that going without sleep makes us feel worse only begins to explain why sleep might be necessary. One way to think about the function of sleep is to compare it to other functions, of our life-sustaining activities. Eating provides our bodies the ability to be able to grow, repair tissue, and function properly. Sleep is the same. Sleep helps us grow by certain hormones, and the other hormones repair our tissues, and it helps us to function in everyday life, in our work, in our personal life. And it's relatively easy to grasp the role that eating serves. However, sleep is hard to grasp, so we have to really concentrate and think about what sleep does for us. And it's you eat, you sleep, you survive, and you repeat. So we have to have sleep to be able to function. And another essential part of sleep is the sleep stages. And we're going to go over the cycles of sleep. Your body cycles through 4 stages of sleep every night. And you got to think about, what is a sleep cycle? Sleep is not uniform. It's not consistent all the time. It's always there, but over the course of the night, your total sleep is made up of several series of the sleep cycle. And they're composed of 4 individual stages. In a typical night, a person goes through 4 to 5 sleep cycles. And not all the sleep cycles are the same length, but on the average, they last about 90 minutes each. And so you have to think about these different sleep cycles. Stage 1, light sleep. Stage 2, intermediate sleep. Stage 3, known as deep sleep. And stage 4, REM, is deep, intense dreaming. So is it normal, for the sleep cycles to change as you progress through your nightly sleep? Are they all the same? No, they're different cycles, and they last different times, and they do different things for our body to help us function. So each sleep cycle is important, and sleep cycles can vary from person to person and from night to night based on a wide range of factors, such as your age, your recent sleep patterns, alcohol consumption. So everybody is different with sleep. And they fall, in the composition of each cycle is how much time is spent in each sleep stage. Changes as you go through the night. Every sleep cycle is going to be different.
Dr. Miracle, one thing I wanted to mention before we move on to the next slide is that there were actually 2 things. I loved your analogy with the food, comparing food intake to sleep. And the reason that I like that analogy is just as when you eat, the quality of the food that you eat has an impact, and we'll call that nutrition, on the benefits of eating. So if you eat high quality, nutritious food, you gain the benefits of that. And the same can be said for sleep. If you have high quality, good sleep, you reap those benefits. And then if you have highly disrupted, poor sleep, that can be compared to poor nutritional eating. And I think the reason I wanted to bring that up is just on this slide, I'm going to ask the viewers to remember the sleep stages and the cycles that Dr. Miracle's talking about. Because later we're going to talk about sleep disorders, and that is what disrupts this cycle and what causes poor sleep to have so many medical comorbidities.
Yes, and I'm glad you brought that up, because I wanted also to include that it does greatly, it's critical, the sleep quality. So many of us focus on how many hours of sleep that you get. Why that is, very important, but it's not the only part of the equation. It plays an important role. However, if you do not have good quality of sleep, it doesn't matter how many hours you're sleeping or in bed, because you have to have quality sleep that's going to be restorative for your body. So that's a great point, Jeff. I'm glad you brought that up. Okay, we're going to go over the different sleep cycles. There are 4 sleep cycles, and stage 1 is non-REM, and it is the initial phase of sleep. It's the transition period between wakefulness and sleep. It's really called maybe like the dozing off stage, and it can last from 1 to 5 minutes. And your body is not fully relaxed, and the brain waves are low amplitude, but there's high frequency. You experience slow rolling eye movement. So if you ever watch someone that's starting to go in this stage, you'll watch their body, their body and brain activity start to slow down. They kind of maybe, you might see someone's body twitch. It feels like you are not really sleeping, because you do have some environmental awareness. And there are light changes, like we said, low amplitude with the brain activity in this stage when you're starting to fall asleep. Also, it's easy to wake someone up during the sleep stage. But if a person isn't disturbed, they can move quickly into stage 2. And this is what we were talking about, the quality of sleep, because this is going to help you move forward and go through each sleep cycle. And an uninterrupted sleeper may not spend much more time in stage 1 as they move through the sleep cycles as the night goes on and on and on. So we're going to go to the next stage, stage 2. And during stage 2, you're less aware of your surroundings. Your body enters a more subdued state, which includes the rhythmic brain waves are produced, sleep spindles and K complexes by the brain are produced. And we're going to go over, when you hear sleep spindles and K complexes, that happen in stage 2, our continuing modules are going to go deeper into these areas. Right now, what we want you to do is just be able to understand that there are sleep cycles. All of them are important. And these are easy ways to explain to your team and to your patients so they understand how important sleep is. Just like we, compare it to eating. It's just an easy way to compare something. And also in this stage, we have decreased body temperature and slower heart rate. Everything, our breathing starts slowing down, so our heart rate starts slowing down. And, like we said with the rhythmic brain waves, they're showing a new pattern, and your eye movement also stops. So you have to look at these things, and you just need to be able to explain what happens in these sleep cycles and be able to observe, the patient, especially in an overnight sleep test. The brain activity slows down overall, but there are short bursts of activity that actually help resist being woken up by an external stimuli. And these can last, approximately 20 minutes per cycle. And people can spend up to 50% in the cycle. Okay, and so now we'll move to stage 3. Stage 3 is considered non-REM, just as stage 1 and stage 2. And like I said before, they're all very, very important. And it just depends on, your sleep cycle, how long you're going to stay in these cycles. Stage 3 sleep is also known as deep sleep. And it is harder to wake someone up if they're in this phase. Your blood pressure and breathing rates begin dropping. And this is normal because this is going to allow for you to achieve restorative sleep. The brain activity during this period also has an identifiable pattern of what's known as delta waves. So in stage 3, you need to remember delta waves. For this reason, stage 3 may be also called delta sleep. So you'll hear different people refer to this sleep stage, as either delta, your deep sleep. It's just referred to different, wording, and everybody has different. It's just like with appliances. Everyone's going to call them different. So if you're aware of this and familiar with all of this terminology, it just helps you remember and to be able to talk to physicians and other dentists and your patients. And the deepest sleep is restorative sleep for physical body. This is a stage 2 that you really need, as we're younger. We talk about the hormones being secreted. This is when children need to have this deep sleep. And, children require a lot more hours of sleep than an adult does. And it goes from infant all the way, to when you're 65, 70. So every person desires and has a different time clock for the amount of sleep that they need. But, the body in this stage is less responsive to noise. So a lot of times, babies, when they're sleeping, you can make noise around them. They don't wake up. Adults, you say he can sleep through anything. Well, that's probably because they're in this deep stage, and so they're not going to respond to noise, but they need this sleep. We need it for our bodies to be restored. And different hormones are going to be secreted during this stage, and we need those hormones. So if you don't go through this stage, you might have different hormones secreted that are going to do more harm to our body than good. Also during this stage, that's when sleepwalking occurs, talking in your sleep. Bedwetting can occur because you're such in a deep sleep that you just can't control things, and you just really, just go so deep, your brain and everything kind of cuts off. And this is a really important stage for your immune system and for your memory. This is, the brain activity is reduced. However, this is really a lot of research has gone on that this deep sleep may contribute to creativity and your memory and to insightful thinking. So this is the stage that is known, like what you learned today during this module, tonight when you are in this deep sleep, all of this is going to come through and you're going to be able to memorize it and remember this. So this stage, like I said, this stage is important too, just like everyone. But, we spend the most time in deep sleep during the first half of the night also. So during the early sleep cycles, this one, lasts, you may be in this stage, for 20 to 40 minutes. And as you sleep though through the night, these stages will get shorter and shorter, and then you'll spend more time in REM as you go through the stages through the night. And so now REM sleep patterns, the brain activity picks up. It's almost so active. The EEG is so similar to being awake because your brain is so active, and it's almost nearing levels when you are awake. At the same time, however, your body is temporarily paralyzed. The muscles are, except for your eyes and the muscles that control your breathing. So this is where you're going to have intense dreams. And the reason that your body is paralyzed, so it inhibits you from acting out on a dream so that you do not hurt yourself or hurt your bed partner. Also, your respiration rate increases. So, like I said before, your eyes are moving constantly. And that's why it's called rapid eye movement, because you can see, even though your eyes are closed, your eyes can be seen moving quickly. This is how this stage, received its name. So you have to think about this. And it usually takes place, the REM cycle, every 90 minutes. And as we are, going through our sleep cycle during the night, this one gets longer and longer and longer. That being said, as we get older, though, this sleep cycle is going to change and it might be shorter and shorter. The different sleep patterns change, and we just have to keep up with them depending on the patient's age. And so this is, when you think about memory and learning, and vivid dreams, this is why the brain activity is so active. And dreams can occur in any sleep stage. However, they are less common, but they're more in the other stages. But in REM, they are common and they are so intense. So you just have to remember this.
As we move on, Dr. Miracle, I wanted to mention something about the brain waves you talked about and the various components to the EEG and some of the other parameters we measure to identify these stages that you've been talking about. I wanted to mention in our module 2, our next level modules, we'll actually go through and look at EEGs and show the listener and watcher, what these brain waves look like. I find it very fascinating, and I always have, and it's one of the reasons I've been in sleep for as long as I have, is that it's just an amazing process that the brain goes through during sleep compared to what we imagine. If we don't think about it, that the brain just kind of shuts down, and that is not the case at all. So if you're listening and watching this and want to learn more, I invite you to, when our advanced modules are available, to check into those, because we'll take a little bit deeper dive into this part of sleep.
Right. And that's what's so good about Jeff and I being partners is, he knows how to read these, sleep studies. He knows exactly what each stage is going through. And I know too, but he knows how to read this, and he can share with you so much of his knowledge to make you feel better about understanding the different sleep cycles. And as we said before, these sleep cycles, they do matter and they are important, because they allow the body and the brain to recuperate and develop. And these are the sleep architect stages that we have been discussing. There is a cyclic pattern of sleep that shifts between different sleep stages. And all of them are important, but you got to remember, if you look at these sleep cycles, one sleep stage, look at the minutes, the times that these sleep cycles are. You see the non-REM, you see the W's wake, REM, and then stage 1, 2, 3 for non-REM. Look at the time, and then look at the all-night cycle. You just have to look at these and understand it. And like Jeff said, the brain plays such an important, it's such an important factor in sleep. And that is how our body, has restorative sleep, because the brain is going to help us get through this. And it's not just about laying down and going to sleep. Your body just doesn't sleep. You have to have help through all different organs, and failure to obtain enough of both deep sleep and REM, it may explain, some of the profound consequences of insufficient sleep on your thinking, when you forget things, when you just can't remember, as quick as you did before, when you fall asleep in your car, your emotions, when your emotions go up and down. Some days you're cranky, some days you're not, or when you're quick to be angry, or you just get frustrated easy, or you're cranky. And this is with children and adults. It doesn't matter if you do not get the sleep you need, and also your physical health. There are so many comorbidities associated with lack of sleep. If you are deprived sleep, you're going to be depressed. You're going to have heart problems. You could have a stroke. You're going to have GERD, acid reflux. There's all kinds of physical problems and issues, high blood pressure, hypertension, that go along with lack of sleep. And if sleepers who are frequently awoken during these early stages, and this deals with people that have sleep apnea, they may struggle to properly cycle into these deeper stages that your body has to have. People like with insomnia, we're going to talk about different sleep disorders. They may not get enough total sleep time to accumulate what they need during each stage. So there's different consequences for not getting the proper sleep architect and going through the certain stages. And that's what we want to kind of explain to each of you so that you can explain it to your patients. And they'll wonder why they don't feel as good as they used to. And if you have a good night's sleep versus a bad night's sleep, you remember, you know what your body needs and how bad it feels, but you also remember how good it feels when you have a great night's sleep. So let's go to the next slide. The disorders of sleep. There are so many disorders of sleep. And when you talk to your patients, we don't diagnose anyway. Dentists do not diagnose, but talk to your patients. Tell them, like when you're doing the screening, that you see something that you are, maybe concerned about, that may be a red flag, and that it may be interrupting their sleep. And it could be anything. I mean, it doesn't mean it's sleep apnea, or, if they snore real loud, that doesn't mean it's sleep apnea. So just be careful with your verbiage with your patients, but be concerned and let them know that you do, you are overall health dentist and you want to help these patients, and you see certain red flags either on their health history or when you're doing a screening. So the disorders of sleep disorders are conditions which result in abnormal changes to sleep. Sleep disorders can affect your overall well-being, your health, your safety, and your quality of life. And when we're talking about your health, we're talking about the comorbidities. When we're talking about safety, that means those patients that maybe work on heavy machinery, driving. So many car accidents are caused by people falling asleep at the wheel and or not being as quick to, move away from an accident. Their brain doesn't think as fast. We're supposed to be defensive drivers. Sometimes when we don't have that sleep, and I'm not referring just to one night. I mean, this is over and over our sleep. If you have a disorder that interferes with your sleep, 5 out of 7 nights a week, it just does not help. Even 4 times, a week if you can't sleep, and your quality of life adversely affects sleep quality, duration, timing, and a person's ability to function properly, not just at work, but in your everyday emotional, mental, and physical well-being.
Dr. Miracle, you said something that triggered a memory from my earlier in my career. I was involved in a research project, and the goal that was being worked on was a way to identify a sleepy driver. So the Department of Transportation felt that drowsy driving was as big or greater threat than drunk driving. And just as we can do a blood alcohol test on an impaired driver because they've suspected being drinking, they wanted to create a similar type of test to identify drowsy drivers. Symptoms of drowsy driving are very similar to drunk driving, and they're weaving, no braking before an impact, things like this that happen with drunk drivers. The exact same thing happens to a drowsy driver. So what we were doing is measuring the pupillary response. So there's a linear relationship between how quickly your pupil responds to a light as to how tired you are. So the more tired you are, the slower the pupil responds. And, although they weren't successful at developing that test, the point of me saying is that drowsy driving is, widely accepted as at least a bigger threat as drunk driving. And some believe it's actually much worse. So you said something that made me remember that. So
yeah. And that's a good point, because people think that you just don't drive when you have alcohol. Well, you shouldn't drive if you are sleeping, because you can fall asleep so easy, and it happens every single day. And some of the most common sleep breathing disorders: number 1, insomnia. Snoring is a common sleep breathing disorder, especially when it interrupts with closing your airway completely. Obstructive sleep apnea, and this is the one that dentists focus on. And this is the one that we try to identify in our patients. We recognize it and we screen for it. This is the one that we notice that maybe this could be what it is, but we don't diagnose, we refer to a physician, either their primary physician or sleep, and they do the diagnosis. We do the screening, the treatment, and the follow-up along with a mutual physician.
As we move to the next slide, I just wanted to mention why insomnia is so important. And the reason is, as you're talking to your patients that are sitting in your dental chair and you're screening for an airway disorder, if you look at the symptoms of insomnia and how a patient talks about their sleep problem, it is very, very difficult to distinguish between somebody that has insomnia and somebody who has sleep apnea or snoring. And because of that, insomnia needs to be something that you're very aware of. We're going to talk about it and understand that from a patient's perspective, insomnia, for whatever reason, is much easier to accept and talk about. And when the patient feels they have a sleeping problem, kind of the go-to problem is insomnia. For one reason or another, sleep apnea is not as acceptable or what have you. So it is important to understand, although insomnia is not directly a sleep disorder, from a patient's perspective, a lot of times they perceive their problem as insomnia. So that's one of the reasons we talk about it a little bit.
And those are great points because, like I was referring to verbiage, when you discuss with a patient, don't say sleep apnea. Do not say sleep apnea. Just refer, the verbiage that we use with our patients is so important. When you talk to the patient, you may, when you're looking at their health history, usually looking at a patient's health history, I can look at that without even looking at the patient and tell there's probably going to be some kind of sleep breathing disorder involved, because you look at the medications that the patient's on, and that's a trigger. And then when you're looking at their dentition, and I announce, to my patients, I just tell them, I'm looking, at your teeth right now, everything looks great. I'm doing an oral cancer exam on you. And I'm also going to do an airway exam on you and a TMJ exam. I let the patients know what I'm doing for them and to them, so they know. And so when I start calling out Mali Potty, or you've got a large scallop tongue, or you've got an elongated uvula, they listen and they're like, what does that mean? And just like Jeff said, sometimes if you look at a patient's history, especially their sleep history, it is hard to distinguish if this could be a patient for obstructive sleep apnea, or do they have another sleep breathing disorder? That's why you do not want to put the word sleep apnea out there, because people do not want to have sleep apnea. They do not want apnea. They don't mind, having insomnia. They don't mind having restless leg syndrome. They'll tell you all that, narcolepsy. But to have sleep apnea is a no-no. It's a curse almost, because number one, people think that's unhealthy. And number two, the word sleep apnea is related largely to a CPAP, which a CPAP is a great treatment. If that patient needs it, it's great. It's the gold standard. And as dentists, we never go against a CPAP. However, patients are scared they're going to have to wear that big thing over their face. And you have to explain to them that there's different options out there, but first they need to get diagnosed. And this is important to be diagnosed, because when one has insomnia, it needs to be treated, because it can be dangerous, just like sleep apnea, on a patient's well-being and their health. And it's the same thing. They have trouble falling asleep. It's hard for them to stay asleep. They may finally go to sleep and then they wake up at 2 a.m. and then they're wide awake. These patients, these people are going to be tired every single day. And it's one of the most common of all sleep disorders. Insomnia affects 6 to 10% of adults. And, these patients you see in your practice every day. And, we really should be screening these patients. Number one, the ADA wants us to screen these patients, but we should be screening and treating and following up with these patients, because it's important even to their oral health. As dentists, when they have something going on, your body, that the mouth is the window or the door to everything. And we all know that, and we can recognize so many things on a patient. And then acute insomnia is stress related. It could be caused from a traumatic event. It could be from a death. It could be from a divorce. There's so many things that can cause a person to have acute insomnia. It could be from pain. If a patient has, continuous pain, they cannot sleep well, even if they're taking medications. It's just the pain trumps, their sleep, and they just cannot do it. And chronic, it lasts for at least 3 months. And these patients need to be followed by a physician, a sleep physician. And then primary is there's really, no cause, in primary insomnia. Secondary insomnia could be from physical pain, from depression, substance abuse. People that drink a lot of alcohol, especially, before they go to bed every night, they are going to have a hard time sleeping. It interferes with your sleep, the architect of sleep. If you're taking medications, and the symptoms is you're going to be sleepy during the day. And so excess sleepiness, that goes along with the Epworth Sleepiness Scale for apnea. So it does get confusing. So that's why you have to bring in a physician to help diagnose what's going on with this patient. The patient's grumpy all the time. They might be diagnosed with depression when all they need is some sleep. They're just going to be tired. It's going to be hard for them to lose weight because they're so tired every day. They don't want to get off the couch. They can barely make it, out of the car. Their memory, is not as quick. And that's what I was referring to. Maybe things don't come to you, like someone's name. If you meet someone and you know that person, you know their face, but their name just can't come to you, and then you might think about it later. That could be caused from lack of sleep. It's not, a lot of people go, well, I'm old, I can't remember things, or, I don't sleep as well as I did when I was younger. A lot of people blame things on their age. And age can affect many things with our health and with our sleep. But if you are an overall healthy person, everything should be good, and your memory, should be great. I mean, a lot of people I know, older patients, they're doing games, they're doing everything in my office. They can remember, something I did on them 5 years ago. I can't, but they can. But, I see a lot of patients, and the diagnosis is done by questionnaires, a sleep log. So you have to, refer these patients to a physician so that a diagnosis can be made. And different treatments, it can be treated with medication, better sleep hygiene, a CBT. So this is the most common sleep disorder. So we need to be familiar with this as dentists. And we'll go to the next another sleep disorder that several of our patients have is snoring. And what is snoring? How does snoring happen? If you look at the diagram, it's when the air comes through the nose, through the mouth. Just familiarize yourself where the tongue is, and the nose and the mouth. When the air comes through, but there's a partially, blocked area where the air is not going through all the way. And that is snoring, a partial obstruction of your airway. And it makes like a really harsh, hoarse sound. And this occurs when the airflow is going past relaxed soft tissue. Because you got to remember, when you're awake, your tissue is not that relaxed because the muscle activity. However, when you fall asleep, everything becomes relaxed. And as we do get older, things are more relaxed. So we all know that your body does everything. So in your airway, so this causes the tissue to vibrate as you breathe. And, nearly everyone snores now and then. I have patients tell me, I'll say, do you snore? They're like, everybody snores, now or then, everybody does it. Is it loud snoring? Has anyone ever, a lot of people go, I don't know, I snore, I sleep by myself. Or I said, well, has anyone ever told you that you snore? That's the question. Really shouldn't say, do you snore? You should say, has anyone ever told you or complained of your snoring? Well, I don't know, it doesn't really bother me. I said, well, you're bothering your bed partner, because if you sleep with someone that snores, your sleep is going to be interrupted as well. And it's called sleep divorce, because then you go into different rooms to sleep. Or if you sleep together, no one's getting enough sleep. And so everyone is going to be grumpy in the morning. And that leads to arguments. And what I do with my patients, with the women patients, because women snore, they have a loud snore train, especially small women. Small women, snore. When you listen, if you listen to a small woman snoring, you would think in your head that it was a 300-pound man snoring, because it can get so deep and so loud. But when I discuss this with women, I ask women if they purr, because I purr. And sometimes I snore or roar sometimes. But, because women do not want to be considered as a snorer, even though women do it. So it's not all men. And it's not always a medical condition, on the spectrum of sleep breathing disorders. However, if it does obstruct your airway completely, then it will be considered, a sleep breathing disorder and something that needs to be treated. And snoring, you can treat snoring as a dentist. However, you can only place a snoring appliance when it has been diagnosed as primary snoring. Don't put an appliance in a patient's mouth if they just tell you they're snoring, because you don't know if it's snoring only. So just remember that you can't treat a patient with snoring unless you know it is just primary snoring. And the only way to know that is for the patient to have a test, a home sleep test or an overnight test. And snoring occurs primarily during inspiration. And this is a potentially serious sleep disorder. And it doesn't go away. Sometimes patients lose weight, and you've got to lose like almost 20% of that weight for it to really make a difference in the number of events you have. And the number of events is what, and we'll talk about that, the AHI. We'll talk about, what does sleep, require? How do you know that you have sleep apnea? And all of this gets, taken care of with a sleep test or home sleep test. But you got to remember the number of events, the AHI, and we'll discuss that. It's apnea hypopnea index. And that's usually the number of events that happen per hour. But you got to remember, it's not all about the AHI. It's also about the patient and their symptoms as well. Someone could be diagnosed with mild sleep apnea, but they could have severe symptoms. So you have to look at each patient individually. And what this does, obstructive sleep apnea, it causes your breathing to repeatedly stop and start during sleep. And there are several different types of sleep apnea, but the most common one, and the one that we work with a physician, is obstructive sleep apnea. And this type of apnea occurs when your throat muscles relax together and they block your airway. And a noticeable sign of obstructive sleep apnea is snoring, especially loud snoring. So that could be a red flag. And we've got this information from the Mayo Clinic. And obstructive sleep apnea is a breathing disorder during sleep, which involves at least 50% decrease to complete halt in airflow, despite an ongoing effort to breathe. So remember that even though you're trying to breathe, but if your airway gets blocked, number one, it's going to arouse you from your sleep. It's going to interrupt your sleep cycle, and it's going to put a lot of work on your heart. That's why patients have a heart attack or a stroke, heart disease. So this is how it affects your physical health. Hypopnea is at least 30% decrease in the blood flow associated with desaturations. And the desaturations in your oxygen level, you need to be 92% all night long. That makes for a restorative night's sleep, and it makes for healthy patients. EEG arousal or both. So you just have to remember, what this is, what you're looking for, and how to screen these patients. Central sleep apnea occurs because your brain doesn't send proper signals to the muscles that control your breathing. So even if this patient had a sleep appliance, they're still not going to breathe. So this is a patient, that has to be diagnosed and has to have some help breathing with a CPAP. And there are several reasons that sleep is important. And we're listing 6 reasons why sleep is the key to a healthy lifestyle. We discussed how eating healthy helps you, and that you can compare that to sleep. When you eat healthy, it's easy to think about it because you're preparing meals, you're digesting, you're eating these meals, digesting these meals, and so it makes you feel healthy. But when you don't get enough sleep, you really don't think of that. And some people don't focus on how important sleep is to continue your body to stay on a healthy route. Everything involves, it all works together. You can't be healthy and work out every day and not expect to have good results if you're not getting good sleep. You're going to injure yourself and then you're not going to heal. You're going to hurt yourself because you're sleepy. Different things are going to project upon you if you don't have good sleep. Your immune system is going to fail. You're going to be weaker, but good sleep helps with that. Also, when you get a restorative quality of sleep, it reduces your stress level. You're able to deal with things so much better with your children, with your patients, with your team, with people in the grocery store, with people on the road. It just helps you see things in a different light. And also keeps your weight in check, because a lot of people, and you hear this and you might be one of them, I'm eating right, I'm working out, but I just can't lose any weight because you've got different hormones secreting. And no matter what, you have to get the sleep so you have the right hormones secreting and you're able to lose weight because you're doing all the right things, except you're not getting the amount of sleep you need. And that's why if you have issues, if a patient has issues, they really do need to see someone about a sleep test, making sure that everything's working well. And because it'll improve everything. It'll improve your heart health. I mean, patients have diabetes, they have hypertension, they're on blood pressure medicine. And a lot of this can change if they can lose weight, if they can get a good night's sleep. So it all works together. And your mental wellness. A lot of patients, and you see patients, start looking at their health history, and you can, memorize certain medicines that you'll see that will stand out for hypertension, for diabetes, for heart problems, for mental wellness. There are medicines that you see, and there's lists of medicines that you'll see on some of our other modules that show you. You don't have to memorize every single medicine, but you need to be familiar with those that stand out. That patients, you'll see them every day on patients. And these patients are in your practice. A lot of patients, are diagnosed with depression when all they really need is a good night's sleep. A lot of children are diagnosed, with ADHD, and they just need some sleep. And lack of sleep, plays a different role with children and adults as well. Adults become really sleepy, cranky, and slow moving. Children, they are very hyper. And so you see it in a different light. So you need to be aware of all of this. You can see children in your practice that maybe, need to be referred. It impacts your exercise performance. If I'm a runner, I ride, I do triathlons, and I can tell a good day when I'm running, and I can tell that I've had I look back and keep a sleep log a lot on what I do. And I can tell if I've had a good night's sleep because I run, I hate to say it, just like the wind, and then when I don't have a good sleep, I run like I have an elephant on my back. And so, and also, it helps you with injuries. So sleep is so important to a healthy lifestyle. In children, in adults, an older generation, everyone needs sleep. Everyone does. Why do we sleep? Everyone wants to know why we sleep, what we do. And just like we kind of compare sleep with eating, a lot of times I like to compare sleep with our cell phones. Because what do we do? We've used our cell phones all day. And what do we do in the evening or during the day? We plug it up, we charge it, recharge it. Because it doesn't keep the energy, just like our bodies. If we could plug into a station, and that's what sleep is. You are plugging into a sleep station, and you need that sleep for everything that we've talked about. For your brain function, you need sleep. Conserve energy to restore your physical body, your emotional well-being, for your memory. And we keep discussing this over and over, but I want to reiterate it because people think that they can get by. And I was one of those people. When I had 3 children, single, had my dental practice, and I worked every day, and I was getting by with 4 to 5 hours of sleep. Because once you put them asleep, then you start doing other things, the laundry, the dishes, working, when I first got in practice, working on my books in my practice, going over things, studying for continuing education, trying to get my exercise in if I could, or waking up early in the morning to exercise. And so, I was making it and I was functioning, but on 100%, no, I was not. I was worn out, but I thought that was the way I was supposed to be because I was so accustomed and so used to feeling like that. I didn't realize that I could feel better and probably be more productive with everything I did. And so it really does help. And you got to think about this. And this is by John Peever. This is sleep served to re-energize the body's cells, clear waste from the brain. So just like your computer, think about, your computer, how you clear your computer out, clear your emails out. We have to clear some stuff out of our brains, and supports learning and memory. It even plays vital roles in regulating your mood and your appetite and your libido. So think about that. And when you talk about sexual dysfunction, and sorry, we're all adults here, people listen. People will listen to you. I mean, I have men that will say, sign me up right away. And women too, it causes it in all adults. So this is just not for, even though the percentage of males, have sleep apnea more than females, we have it too. As a female, we need to take care of ourselves and think about it. Slide, and we're going to talk about the hours of sleep. Like I mentioned earlier, how much sleep do we need? Infants, 4 to 12 months, they need 12 to 16 hours in a day. They need to be sleeping all day. They really do. Just like a new little puppy. My little puppy sleeps all day long. He's got the life. And babies, they just need you to love them and let them sleep and feed them and change them. Toddlers, they need 11 to 14 hours. A lot of times, when children are, toddlers or preschool, and they, even school age, they're young and they may talk too much in the classroom. They may not listen. They may, you may be getting notes back, they won't pay attention, or they're not doing well, in school. Even teenagers, it's because they probably need sleep. So think about that and, educate your patients. Just like we educate them about hygiene, oral hygiene, we need to talk to them about sleep hygiene as well. And adults, we need 7 or more hours for sleep. We do need it. I know people say, I just need 4, I need 5. And I used to be one of those people, but we need 7 or more hours. I feel so good when I have 7 hours of sleep. And you probably do too, as well. Slide. And what if you are deprived of sleep? What does it cause? What does it do? Mood changes. Your mood, I tell you, it is very dependent upon your amount of sleep. People wake up grumpy sometimes. Some people wake up and they're ready, to seize the day. And, it just depends. Everybody's different. People, I'm not a morning person. I'm a night owl. Or, well, if you probably went to sleep, you might become a morning person. Chronic diseases, your body can't heal. It almost becomes worse and worse because you're not getting restorative sleep. Poor motor function. As dentists, those of us that still practice, drilling and filling, we need great motor function. We need to be able to make sure we're on the right tooth. Just like surgeons, when, they mark if you're having surgery, they'll put right or left and they circle it. Too bad we can't do that in the mouth to make sure we're on the right tooth. But I write it down everywhere. And my assistants and I, we double check every single time. So these are the things, that going without sleep, like Jeff mentioned earlier, car accidents. If I'm driving and I see someone beside me yawning or kind of in a daze, I move as quickly away from them as I can. Especially on a highway. I've even pulled over before to let those, the car pass me. because, they were weaving, on the road, just like alcohol. Sleep, being deprived of sleep is probably, like just said, worse. And they've done studies on that than someone having alcohol in their system. Sleep and hormones. What does it do? How do how are they together? How does this work together? There's leptin, ghrelin, growth hormone, insulin, and neurotransmitters, which reduce waking brain function and increases your sleep functions. So on the next slide, we're going to discuss the lack of sleep. It leads to affecting your insulin production, which increases your adrenal stress and cellular resistance to insulin. And so this shows abnormalities in insulin production. And this is a process that can lead to a high increase of contracting type 2 diabetes. So when you look at a patient's health history and you see type 2 diabetes, ask them, have you ever had a sleep test? And it may, they may be fine. I mean, they may be sleeping well, but that's a red flag. On my health history, I have on my form, and this is everyone fills this form out. It's not just for my sleep consult patients, not just for my sleep patients, it's for everyone. Do you snore? Has anyone ever told you that you snore? Have you ever had a sleep test? How do you sleep? Are you tired during the day? And talk to the patients. And when you hand them, sleep questionnaires, talk to the patients, listen to what they're saying. You can get more from listening to a patient than you can by just explaining to them about health history. You need to really learn how to listen to your patients and let your patients talk, because that's when you're going to hear, like you can ask them a question like on a form, do you gasp? Do you choke? They'll have no. But then when you talk to the patient and go, a lot of times I said, I've been woken up because I gasped at the very beginning. I thought I was having a dream, but then I realized it was my airway. And patients will go, yeah, I do that too. So talking to patients is going to help you better understand and help them understand.
Dr. Miracle, one of the things that I'm very passionate about, in my work history, I spent most of my career on the medical side, developing sleep diagnostic instruments and working with physicians. And one of the things I want to impart on the group is that you will be shocked at how many patients are out there are being treated for obesity, high blood pressure, diabetes, and depression, and they've never had a sleep study. And not that the sleep issue causes all that. In some cases, it causes some of it or contributes to it. But managing those conditions in the presence of an undiagnosed sleep disorder is very, very difficult. And so when you're talking to your patient, just as Dr. Miracle was talking about, and you're listening to them and they say, yeah, I've been on I take a diuretic and I'm on blood pressure medication, and ask them, well, how is that going? And if they say, well, I've been doing this, it doesn't seem to help much, but my doctor says I should take it, that's an immediate red flag, because in my view, one of the primary reasons medications and treatment aren't as effective as they could be in a lot of these patients is that the sleep disorder creates tremendous headwind against therapy on these chronic conditions. And for one reason or another, it's not occurring to the medical provider to ask, a couple simple questions about their sleep. So this is where your role as a dentist can be critical, because here's what happens is when you get a patient who's not sleeping well and resistant to the therapies that they're getting, whether it be medication or what have you, and then you initiate treatment for their sleep disorder, the other therapies can oftentimes become much more effective, and the body will respond to them where they haven't in the past. So when you bring up, let's say, a weight loss program, or you bring up, how's that blood pressure, when you manage their airway, you'll be able to get a much better response from the therapy. And I don't know that there's a more important reason than that to help the patients that are sitting in your dental chair.
I agree with that totally. And that's why you really need to update their health history, once a year. You need to talk to patients. So many times I will say to a patient, so you didn't mark on here that you had high blood pressure. Oh, well, I don't. I said, well, you take medicine for it. I know, but the medicine, so now I don't have it. I said, yeah, you still have it. You're treated for it, and so they need to understand and they need to own it, and so many of these things I could tell you, like they relate to dental. When you talk to a patient and talk to them about perio pockets, probing, when you call out 222-333-456, you need to have your hygienist emphasize that. You need to explain to them when they hear, 4, 5, and 6, that's not good, so that they're involved in their situation. It's just like the lack of sleep. They need to know that the way they feel and the medicines they're on could be related to lack of sleep. It doesn't mean they're going to get cured because they get good sleep, but it's going to make their health better and the situation around it better. Just like lack of sleep leads to adrenal glands, producing increased cortisol levels from state of stress. So sleep does that to your body. It causes one to have trouble falling asleep or staying asleep. So a lot of times, when people feel tired, they cannot fall asleep because something going on with their health issues is causing this to happen. But people, sometimes they've been doing it for so long, they don't realize it's not normal. And I'm telling you what, when you can help a patient feel better and get the help they need, and I'm not saying this to put any physician down, because I work with a lot of them, they are great, but physicians have so many things that they're going on and going, with the patients, and they're focusing on. That's why really and truly so many physicians want to have a mutual partnership with the dentist, so that we can recognize a patient that may have some kind of sleep issue by screening them, because as dentists, we're in a unique situation. We can see the airway probably better than any other healthcare. And so we need to take advantage of that. Even if you decide not to do sleep, treat with appliances, but you need to know how to refer these patients. We need to help these patients. There are patients too. And, we have a bond with these patients. Not only, do we see the patients, we see families. And so that gives us another advantage, because sleep apnea can go from grandfather to grandson and in between and to siblings. So we have such a unique advantage, and we need to take advantage of that as dentists, because we see it and we need to help educate our patients. Also lack of sleep, it can interfere with your thyroid function. It increases the thyroid stimulating hormone. It slows down your metabolism. And here we go again. This can be related to weight. It's hard to lose weight when you have this, and then you gain weight. You'll see patients that come in, and I'm not counting the COVID, because I gained the COVID-19 plus, goodness. I mean, running, everything kind of went out, the way. But but people that have hard time losing weight, and they get depressed about it, and they stop and they give up, and it could just be they need a good night's sleep. So, I'm not saying everything that people have, but sleep is so important for patients. Jeff and I both are so passionate about what sleep does and how it relates to patients and people and individuals, and how you can change your whole life by getting restorative, good quality sleep. And it's free. It's free. It's just like the air to breathe. So you need sleep. It leads to an underactive thyroid. So it increases your tiredness, your hair loss. People, older women, losing their hair, your skin texture. It causes GI problems. People get, GERD, acid reflux. That's a red flag when you see that on the health history. Women, teenagers, their menstruation cycle is confused. It's, just backwards. You're depressed. You can't sleep. You're just always cranky. You don't feel good. You want to feel like you did before. Well, sometimes sleep can do the trick. Your blood pressure, your cholesterol level, it all works together. And that's how we need to educate our patients, educate ourselves, educate our team so that we can, lead a perfect example of what's going on here and how we can help our patients, because it all does relate to the oral cavity. Like I said before, the oral cavity is the door to your health. And here again, we're going to talk about weight. Leptin is a hormone that is secreting, and we need that hormone because it tells us when we need to push the plate away. And it also tells us that we have energy to go do something, to get up and go for a walk or go for a run or go ride your bike or go outside and plant flowers or play with your grandchildren. Whatever you do in your life to keep you active, if you don't have the right hormones, and that's from lack of sleep. So lack of sleep, there causes an increase in ghrelin. And the way I remember ghrelin is I think of a gremlin as bad. So when you have an increase in ghrelin and a decrease in leptin, because leptin, suppresses your appetite, and it's a hormone that's produced by an appetite suppressing that hormone depresses by fat cells at night. A lot of time people, I have a girlfriend, she's a dentist too, and she tells me, oh my gosh, I get so hungry at night. And she kept telling me that. And so when she came in, I did an exam, I talked to her about it, and I talked to her doing the sleep test, and guess what? Yep, she has sleep apnea. And now that she's being treated with a sleep appliance, because she has mild to moderate, and she was diagnosed, we went through all the protocol, even though she's a dentist, she goes, just give me one. I said, no, I'm not doing that. We want to make sure that we're helping the patients, even our friends, in the right way, other colleagues, and that's what it was. She had an increase in ghrelin. And so a hormone is released by the stomach that stimulates hunger at night. And she had poor sleeping habits. She was up all during the night, all the time, but that's what she had been doing for so long. She thought that was normal. And then she was gaining weight and she wasn't happy. So now she is a happy girl and a great dentist, and she can help her patients because she went through this. So all in all, with this module, we want you to come out of this module knowing what sleep is, the different sleep cycles and remember, they're all important, and every patient needs to go through these sleep cycles, and they last at different stages, of your life. And age can affect your sleep cycles, recent sleep patterns, alcohol, and different other sleep disorders. They can overlap each other, and what the purposes are. And the architect, we want you to be familiar with the common sleep disorders. Insomnia is the most common. The one we deal with is going to be obstructive sleep apnea, and there are 3 different types. And the health consequences that occur when there is poor sleep. And just go away with this thought. Poor sleep has consequences. It causes mental, physical, and emotional well-being. And you need to remember that it's not the number of hours that you sleep. It is very important, but it's not the entire equation. Sleep has to have good quality, and it has to be restorative sleep. And so each of us need that sleep. I don't care who you are, and you need to sleep in a healthy sleep hygiene area. And we'll discuss those on different modules, but just go away with knowing that everyone needs sleep, and you need good restorative sleep to help your body reflect the different consequences of poor health. Hope you have a good night. And if you have any questions, just contact Jeff and I, either by our emails or on our cell phones. Thank you so much for joining us.